Wake up! It's midnight. Time for our daily conversations.
I'm so tired. Be quiet.
You never got the files done at work. Dr. Thompson's going to be so mad. Your final is due on Thursday and you haven't even started it.
Oh my gosh. Leave me alone. I just need to go to sleep.
Okay. Nicole, now you mentioned earlier that you were feeling trouble sleeping. Okay, tell me about that.
Yes, I just can't sleep at night. I'm tossing and I'm turning and I literally would try and fall asleep, and then if I do, I'm up and my mind doesn't stop.
Your mind doesn't stop. You mean like the tapes are playing over and over
Right.
and you can't turn them off. And you wish you could.
I'm just tired
Yeah.
and I can't get a good night's sleep.
So the most important thing is what we call sleep hygiene. And I can go through that with you. But you've asked for a medication. So the medication that I would prescribe is a drug called Zolpidem, which is also by brand name Ambien. You've probably seen it on TV.
Mm-hmm.
And it is a medication that you would take for a very short period of time. You do not want to get hooked on it because any medication for sleep stops working after a couple of weeks. And then you're stuck on it for lousy sleep that you used to have without the medicine.
Mm-hmm.
So you would use this at the beginning a few days in a row, maybe 3, and then try and take it every other night and then try and get off of it.
Mm-hmm.
Some people experience drowsiness the next day. So you have to be careful about that. And they can also have other kind of weird things, like they just don't feel themselves. They have hallucinations or they have trouble with memory. Sometimes there are other things that are more serious, but those are uncommon.
Mm-hmm.
So what I'm going to do is just prescribe a couple of weeks worth.
Okay.
So 14 of them, and use about 3 nights in a row. And then try and wean yourself off, taking it every other day, then every 3rd day, and then stop them, and you'll have a few left to use at a later time.
Warnings while using this medication include: tell your doctor if you are pregnant or breastfeeding, if you have kidney disease, lung disease, or breathing problems. Tell your doctor if you have a history of alcohol or drug addiction, depression, or mental health problems. This medication may make you dizzy or drowsy, especially first thing in the morning. Do not drive or do anything that could be dangerous until you know how this medication affects you. Use this medication only when you cannot sleep. You do not need to take it on a schedule. This medication is not for long-term use and should only be taken as directed by your provider.